It is your health and it's football season, and as the season progresses, so does the excitement, but also injuries. Dr. Michael Justice, orthopedic surgeon and sports medicine specialist with the Research Medical Center, is here to talk about ways to prevent injury. Dr. Justice, tell us, what are some of the most common injuries you see?
Hey, well, thanks for having me, Kelly. We see a lot of athletic injuries. One of the more common things that you hear about on the news, and one of the more common things we see is an ACL tear of the knee. We see shoulder and ankle injuries, though, as well. All these are pretty common, ankle sprains, things along those lines. So,
what exactly is an ACL? We hear a lot about that. How do those injuries happen?
Yeah, so an ACL tear is one of the more common things that we see, especially in contact sports, but also in non-contact sports. So the ACL is one of the four main stabilizing ligaments of the knee. It, interestingly, about 70% of the time is torn in non-contact injuries. So where people are decelerating, cutting, pivoting, changing directions quickly. Sometimes they may be out of control, especially like on a basketball court. They can hyperextend their knee, and just in a split second, they can tear their ACL. They often describe feeling a pop or maybe even hearing a pop. They'll have fairly sudden onset swelling. It's a pretty tough injury to come back from an athlete, but with the right intervention, usually people are getting back these days.
So what kinds of treatment plans do you normally put together for those kinds of injuries?
Usually, especially in the athletic population, we're recommending surgery for most of these patients. The ACL, unfortunately, doesn't have much capacity to heal on its own, so we have to reconstruct it. But, most people are able to get back to sport, hopefully to the same level of play that they were at before. That's our goal. So usually it's a surgery. Sometimes we have to wait a little while to let the knee kind of calm down if it's too swollen and too stiff to operate on right away. Sometimes we're able to operate on them sooner, but overall they get into physical therapy shortly thereafter and start a fairly vigorous rehab process. Most of these patients end up coming back to sport sometime in the 7, 8, 9 month range.
And you treat all kinds of athletes. So what kinds of injuries do you see with the everyday person? Any advice for them?
Absolutely. We do see pretty much any and all comers, not just young competitive athletes. So one of the more common things, that we see in adults or weekend warrior type folks are, rotator cuff tears, sometimes just a sprain or a strain of the various joints. We see a little bit of anything and everything, and happy to take care of all comers.
All right. Thank you so much, Dr. Justice. That was some great pointers that you had for people to make sure that they're staying out of those emergency rooms during this football season. For more stories just like this one, head over to our website, kctv5.com/HCA Midwest.